This is our second round of testing. A couple weeks back we did 3 weeks of testing at the tribal complex. So this round we actually went out into the community. We are testing at 11 different sites, 2 days each, so we'll be doing 22 days of testing. And we wanted to go out into the community to actually provide access into the communities where our families live. And we're in phase 2 with the governor's orders. We're trying to get to phase 3 to fully reopen. But in phase 2, people are venturing out more, so we are having more one-on-one contacts, and we're seeing our numbers, our COVID positives rise.
It's just a way to reach our people during this pandemic. We are in a spike area where our numbers are growing, especially amongst our Lumbee community members. And we thought that we'd be past this by now, but we're not. So we're just happy that we're able to use our not-in-the-hospital funds, and that we had the flexibility and the IHP that our council approved and that HUD approved for us to be able to do this for our people.
With the CARES Act funding, it's enabled the Lumbee tribe to be able to get into our communities. We have decided and found that it's more important for us to get into our small communities and that we would have better outcomes by allowing tribal members and the community members to come to locations that they're comfortable with. We're going to be out and about at other churches, at other fire departments, places where people are comfortable, and we feel like it makes it easier for them to come out and to receive additional services such as food, supplies for their kids, supplies, PPE. We are working with our local farmers to provide fresh produce. Each day that we are providing these services, these much needed services, the produce is coming straight out of their gardens. And not only is that good for our tribal members, but it's good for the farmer. It's an economic boost for him as well.
This is a good thing that you guys are doing, because in Robertson County, it's just running rapid, and it's a good thing that you guys are doing. And that's one of the reasons I wanted to come, because the tribe had put it on, and it was, you know, I just thought it was a good thing to be safe and sure, you know, because I know of people that's had it and didn't have symptoms, and I just wanted to make sure.
It's not that people are out of their homes or they're flooded, but they need food, they need cleaning supplies, they need PPE, they need access to testing. So we were well prepared for this and have great collaborations. We've had collaborations with the governor's office, Governor Roy Cooper, with U.S. Senator Tom Tillis and Richard Burr, with our Congressman Dan Bishop and Butterfield and Hudson. So it just takes these types of collaborations. If the Lumbee tribe were fairly recognized, we'll be entitled to the $8 billion that was sent out across tribes for fairly recognized tribes only. And we don't enjoy the services of Indian Health Services or Department of Education. So we had to put these partnerships together to bring money sources together to be able to serve our people the way we've been doing, and we're just grateful to do it. Our Boys and Girls Club kids have been out since March. School's been out since March. So our Boys and Girls Club really stepped up, and they're sending out kits of supplies, of teaching supplies, learning supplies, art supplies, and then we send out a where to go to on a video to shows the kids how to put the projects together. So it's really a virtual thing that the Lumbee Tribe Boys and Girls Club has done to keep teaching our kids outside of the public schools, and we're very proud of that.
This is timely. You know, our whole purpose, and I've said this earlier, is to encourage our tribal members and community members to stay in place, to stay at home, not to be out and about into Walmarts, into the grocery stores, trying to provide these additional and essential items to them will hopefully keep them from having to be in a store, in a grocery store, around a lot of people. We just encourage our tribal members and our community members to come out, participate, and to get tested. The more we know and the smarter we are with this, I think we'll soon see a change and flattening the curve.